got a few people that are running late that will be coming in, but we'll go ahead and get started. First up, I'll ask for requests for bill introductions. Is there any? I have one. So mine is RS 2396, and the short title on that is removing non-cooperation with child support from requirements for food and child care assistance eligibility and exempting adults enrolled in school from the 20-hour per week work requirement for child care assistance eligibility for a limited time. Are there any questions on that? Any objections? Okay, without objection, then the bill will be introduced. So that's the only housekeeping I have. So we will turn to our first presentation, which we have former Senator Randall Hardy joining us from the silver-haired legislature, and he's joining us virtually. Sure, Representative Johnson.
Thank you, Madam Chair. I just wanted to introduce from the Leavenworth County Silver-haired Legislature a very great representative. Her name is Sherry Grogan, and she's here to listen to their presentation, and I'm very hopeful she'll continue to work with us. She's a very caring person in our community. And then also I must leave to go carry a bill in another committee. Thank you.
Thank you for introducing her, and thank you for being here. So, Randall, are you online?
Okay. Can you hear me?
Yes, it's good to, I can hear you, and it's good to see you.
Very good. Well, I appreciate this opportunity to appear before your committee representative and chair, Kincannon. I knew that our representative, Sherry Grogan, was going to be in the audience today, and I appreciate her attendance. And I am here as speaker of the Kansas Silver-haired Legislature. And as the chair mentioned, I'm also a former state senator. I served from 2017 through 2020, and I would label that now normal time in the legislature. I appreciate this opportunity to speak to you briefly about our organization and our priorities. I was scheduled to be Speaker Pro Tem initially, but our speaker at that time was appointed to the state legislature. His name is Chuck Schmidt from Wichita. So if you run into him, let him know I said hello, and I wish him well during this session. I think that what I'll do right now is to give everyone a brief introduction of the Silver-haired Legislature, just in case you need a refresher course, or there may be members that are new to our organization. The Silver-haired Legislature was enacted by an act of Congress in 1969, and each state was encouraged to create a body of seniors who would identify issues important to older Kansans 60 plus years, and to educate the Kansas legislature about those issues. The Kansas Silver-haired Legislature itself was created by Kansas Senate Concurrent Resolution number 1649, which was passed by the 1982 legislature. It created a new unicameral legislature composed of 125 representatives, a lot like the House, and all representatives of the Silver-haired Legislature are 60 years older, and are elected from their county of residence. The exception is that Wyandotte, Johnson, Shawnee, and Sedgwick County have 5 additional representatives. because of their population. The Silver-haired legislature provides opportunities to identify priority concerns of Kansans over the age of 60, to develop bills and resolutions designed to address those identified concerns, and to present those resolutions to the Kansas legislature and governor as recommendations for state policy. So what are responsibilities of the Silver-haired legislature? We are not a lobbying organization. We are a 501c3 organization. So we advocate for Kansas Silver-haired legislation with state legislators. We testify at hearings held regarding our legislation, and we meet with seniors in our counties and districts about legislation affecting older adults. So who may become a Silver-haired legislator? Well, we'll take any ex-legislators that they work really well as advocates for older Kansans. But any Kansan age 60 or over who is a registered voter may file for candidacy. The term of office is 2 years, and members may file for re-election. This is my first term as part of the Kansas Silver-haired legislature. So how is our group funded? The Silver-haired legislature is supported by donations and volunteer help. Contributions are tax deductible and may be made payable to the SHL treasurer and sent to the treasurer or to any area agency on aging. We are connected to the area agencies on aging in Kansas. We have 11 districts in the state of Kansas, and I'm part of one of the areas agency on aging, as well as every member in the group. The Silver-haired legislature represents approximately 600,000 senior citizens in the state of Kansas, and this demographic will continue to grow over the next several years. So we're going to, our needs and our voice will need to become prominent in the halls of the State House, and I'm hopeful I'll be able to participate in person down the road. We meet throughout the year to assess and determine the needs and priorities of the senior population. We then take our top priorities and craft resolutions or bills that can be presented to House committees, generally the House Committee on Children and Seniors. We are assisted by research and the revisor's office at the State House to draft our documents. Our first priority this session is to expand Medicaid to all eligible Kansans. There are approximately 16,000 of those Kansans who fall into our age group that would benefit by having access to Medicaid. Our next priority is to support the availability of wireless broadband access and funding, including training and assistance for use of wireless internet for all senior Kansans. We urge the legislature and governor to fully fund all KPERS obligations and include a cost of living adjustment for retirement members participating in KPERS. KPERS, during the whole 4 years I was in the legislature, of course, was a major topic of interest and concern for all retirees, and it still is. We urge the legislature to continue supporting and funding collaborative community-based transportation systems for senior citizens and support local entity involvement in control when establishing such systems. We have, for instance, a system in Salina called CityGo. And CityGo is a local transportation system, a bus system in particular that takes care of the general population, but seniors benefit greatly from the system because it also provides transportation to medical appointments. And we also have buses that travel as far as Concordia and Belleville to provide transportation for needy citizens to shopping and other services in Salina. So we urge systems like that to exist all over the state. We urge the legislature also to support, well, it was SB 76 from the 2021 session or an equivalent, and that was the Golden Years Homestead Property Tax Freeze Act. Many seniors, as you probably can guess, are on a fixed income, and this bill would provide needed support for Kansas seniors that have a limited income that become increasingly unable to afford the property tax in their homes that have risen over the years in value. We also urge the legislature to expand current law to include the medical use of cannabis. During my time in the legislature, I saw many Kansans come to the State House to testify on how they could benefit from the use of medical marijuana. I remember in particular a toddler who was having many seizures during the course of a day, and the bill that we passed that year provided much needed help for that toddler to deal with that illness. Lastly, we urge the legislature and governor in the state of Kansas to continue to protect grandparents' rights regarding the placement, legal guardianship, and adoption of grandchildren who are in need of care, and that the legislature lower the age requirement for participation in the Grandparents as Caregivers program to grandparents 40 years of age or older. Currently, the minimum age is 50. We talk about this particular issue because you can do the math, and it's you can probably understand that there are many more grandparents under the age of 50 now than there were possibly 10 or even 20 years ago. Having grandparents meet that minimum requirement at the age of 40 would help many families in terms of needed funding to help care for children who are in need of care. Many of these priorities would benefit many Kansans in addition to our senior population. As you know, our Silver-Haired Legislature is not a lobby organization. Our purpose is only to inform and educate legislators of the needs of our senior population in hopes of making life better for seniors and by extension, all Kansans. As a former member of the legislature, I understand the challenges and difficulties of passing legislation. Members of our group are happy and willing to testify in support of any of these measures, and we look forward to working with your committee and the legislature and having at least some of these priorities become law. I appreciate the opportunity to share with you our thoughts about the 2022 session, and now I will stand for questions. But before I do that, I have a point of order question, Chair Kincannon. We have several resolutions that I would like to introduce and I didn't do that when you asked for the introduction of bills and resolutions. Is it okay to do that at this point?
Yes, and I have to tell you what, I just saw a text message where you asked me that question, and I'm sorry I missed it.
That's okay.
But I didn't want to interrupt you by texting you back right now either. But why don't we take questions first?
All right, very good.
So does anyone have questions regarding the role of the silver-haired legislature? Representative Hoy.
Thank you, Madam Chair. Good to see you, Senator Hardy. I have just a comment. It struck me when you mentioned about the number of individuals in Kansas and the coverage gap in the age group that your silver-haired legislature represents. And I actually came into contact with a constituent in that case, and he had actually left his job in order to care for 2 elderly parents, and it was just a circumstance I hadn't really considered before. So I appreciate that you're advocating on those folks' behalf. My second is a question on lowering the age requirement for participation in the Grandparents as Caregivers program. Is there a reason to have an age requirement at all? Or I guess, could you provide a little bit more information on that? I'm very interested in that issue.
I thank you very much, Representative. I think that the age of 50 was selected because we like certainty in the legislature, and that gave us a level of certainty so that we would could determine who would qualify for benefits and who would not. And I think that people are just more comfortable knowing what the minimum is. 40 is probably as low as we would need to go anyway, just given the constraints of you know, how things play out. I think, but that's just my guess on that one.
Other questions? Representative Wagoner.
No, thank you, Madam Chairman. The Silverhead Legislature, of course, I was very unfamiliar with them until I got up here. But so do you folks, do you meet, like do you guys have like a weekend at the here in the Capitol building where you get to do your deliberations, or is that done some other location?
Thank you very much for that question. We are on COVID time right now. In the past, the legislature has been very gracious to grant the Silverhead Legislature a day at the State House in the House chamber and a few committee rooms in order to conduct our business there. This year, because of COVID concerns, we decided to have our annual meeting virtually. We did it by Zoom, and so everyone could participate. It worked pretty well, but our preference would be to take advantage of the State House as we've done in the past, just because it provides a better venue for communicating our concerns and having robust discussions about various issues.
Representative Owsley.
Thank you, Madam Chair. Not so much a question, just a comment. So congratulations upon being Speaker of the Legislature, and I will tell Representative Chuck Schmidt that you said hello if you will tell Don hello for me the next time you run into him.
We'll definitely do that.
Thank you.
Further questions? Okay, what do you have for resolutions?
Well, we have 6 of them, and the first is called Silverhead Legislature Resolution number 3902. It's a resolution supporting wireless broadband access for all senior Kansans, including the training and assistance for use of wireless internet. One comment I have, I just had an email from someone who said that there was a cardiologist that found there were many dead spots in the state of Kansas where he was trying to download medical information, and that makes it difficult when we do not have adequate broadband access. And so the first resolution, 3902, would address that. The second is Silverhead Legislature Resolution number 3903. It's a resolution urging the legislature and governor of the state of Kansas to fully fund all KPERS obligations, to stop delaying KPERS employer contributions payments, and to fund a cost of living adjustment for retired members of KPERS. The next resolution is Silverhead Legislature Resolution number 3904, a resolution urging the legislature of the state of Kansas to continue supporting and funding collaborative, community-based transportation for senior citizens, as I discussed before. The next resolution is Silverhead Legislature Resolution number 3905. a resolution urging the legislature of the state of Kansas to support 2021 Senate Bill number 76 or similar legislation during the 2022 regular session to provide property tax relief for certain senior citizens and allow these individuals to maintain their standard of living amidst continually rising property taxes. Silverhead Legislature Resolution number 3906, a resolution urging the legislature of the state of Kansas to legalize the expanded use of cannabis. And lastly, Silverhead Legislature Resolution number 3907, a resolution urging the legislature and the governor of the state of Kansas to continue to protect grandparents' rights, especially when considering the placement, legal guardianship, and adoption of grandchildren who are in need of care, and to allow more grandparents in the raising of their children in Kansas. And that is by changing the age of grandparents from 50 to 40. And that is what we have.
Do you happen to have RS numbers for those resolutions?
You know, I do not. We did have Mr. Wagner draft these for us, and that was the other question I was going to ask for you. I could work with Mr. Wagner too to get those. I thought they would be here, but they're not.
Okay. I think what we'll do is if we have questions, we'll take questions while we have you with us, and then I think maybe we'll wait till Monday when we potentially would have an RS number, and if you want it introduced as a committee resolution.
Okay, now all of these did pass unanimously. I don't know if that in our group, I don't know if that matters or not, or if resolutions, I didn't know if they required the same RS numbers as the bills would.
They just hold on just a second. Okay, if you would like to have those sponsored, introduced to the House and sponsored by this Committee on Children and Seniors, then we do need an RS number. We can go ahead and discuss those today, and then I can introduce those for you with an RS number on Monday or Tuesday, whenever we have it available. Does that work for you?
That works great for us. I appreciate your working with us on that.
Yeah, no problem. And I'm happy to hear that they passed with a significant margin. So are there any questions on any of them by the committee? Okay, seeing none.
Mr. Wagner was the person that drafted these resolutions for us.
Okay.
So they're in good shape to be introduced.
Okay. Well, our revisor will work with him.
Okay. Very good.
So yeah, thanks for that information. Well, it's great to see you, and thanks for joining us and taking the time, and come up to the Capitol and see us sometime.
I am itching to do that. I look forward to seeing everyone before too long. Thanks.
Okay, thanks for being here. Bye-bye.
Bye-bye.
Okay, next up, we'll call on Connor to give us a Senior Care Task Force report.
Thank you, Madam Chair, members of the committee. My name is Connor Stengler. I am with Kansas Legislative Research Department. I am your friendly neighborhood research staff here on committee. I am just going to provide a brief overview of the report of the Kansas Senior Care Task Force to the 2022 legislature. That was provided as testimony, and you can also find it online at the Kansas Legislative Research Department website. That's ks.gov. This task force is actually still ongoing, and it sunsets in June 2023, although the chairmanship switches this year, but committee task force membership, rather, will remain the same until the sunset date in June 2023. I'll also refer to page numbers in case you're following through the report as we go. But just for background, the Kansas Senior Care Task Force was created by HB 2114 in 2021 with a sunset date of June 30th, 2023. HB 2114 directs the task force to study the provision of care for Kansas seniors who suffer from Alzheimer's disease, dementia, or other age-related mental health conditions, the administration of antipsychotic medications to adult care home residents, safeguards to prevent abuse, neglect, and exploitation of seniors in the state, adult care home surveys and fines, the funding and implementation of the Kansas Senior Care Act, senior daycare resources in the state, and rebalancing of home and community-based services, HCBS. So the task force is composed of 22 members. You'll see the membership on the first page, the cover page of the report with the specific names. And then as you get into the report, you will see the membership as required by the bill, HB 2114. There are legislative members, including 3 members of this committee serving on the task force, and then there are non-legislative members as well, and those have defined roles that you'll see. So for example, one representative from the HCBS community appointed by Interhab, the state long-term care ombudsman, and so on and so forth. The first chairperson of the task force is Chair Concannon, was Chair Concannon last year, and then this year it will be the chairman of the Senate Public Health and Welfare Committee, so for 2022. A final report of the task force study is due to the legislature on or before the beginning of the 2023 legislative session. And you will see that the work of this year's task force during the 22 legislative session will ratify its report in July 2022 and present its report to the task force in August 2022. So just a bit about the structure and organization. This task force is a bit different. So at one of the first meetings, a presentation by a representative of the Kansas Health Institute, KHI, discussed the working group concept, which is what this task force employs. The task force approved KDAD's offer to coordinate a contract directly with KHI to establish smaller working groups within the task force, with KHI facilitating those working groups. The task force sought and received LCC approval to create working groups to assist the task force in studying and making recommendations on the assigned topics. Within the task force, 2 working groups and 1 subgroup were formed. The 2 working groups are quality of care and protective services. That's the first. And then the second is access to services, and the subgroup is the workforce subgroup. So each of those work groups and the workforce subgroup sort of focus on those topics. And they meet as smaller groups and then bring recommendations and ideas back to the task force. And those working groups are meeting currently during this 2022 legislative session. So you'll see that the quality of care and protective services work group studies the administration of antipsychotic medications, the safeguards to prevent abuse, neglect, and exploitation, and adult care home surveys and fines. And then the access to services work group studies the provision of care for seniors in the state who suffer from Alzheimer's, dementia, or other age-related mental health conditions, and the funding and implementation of the Senior Care Act, as well as senior care day resources, senior daycare resources in the state. So KHI began the facilitation of those work groups at the December 14th, 2021 meeting. They meet twice per month for 90 minutes each. And as I said, they'll continue to meet throughout the 2022 legislative session. I just wanted to touch on a few topics that the task force reviewed before I get to the recommendations throughout the year. So at the first meeting, the Secretary for Aging and Disability Services addressed the task force and gave a broad overview of aging in Kansas and the state of seniors in Kansas. She noted the aging of the American population, stating the U.S. Census Bureau estimates in 13 years, for the first time in history, older adults, defined here as 65 and older, are expected to outnumber youth. By 2030, when all the baby boom generation are 65 years and older, They will make up 21% of the population. That's up from 15% of the current population. And there's also some stats in the report on the Kansas population of seniors. The Deputy Secretary of Programs, KDADS, provided a review of the Senior Care Act, a Kansas-specific program established in 1989. This program assists older Kansans who have functional limitations but are able to reside in the community with support services. And those services aim to prevent premature nursing home placement for persons who have not exhausted their financial resources. In FY 2021, that program served about 2,100 seniors. There are about 300 to 400 persons on the waiting list for Senior Care Act services in the state. There was also a presentation on the 2020 Alzheimer's disease plan, and I'll just point out that there were several recommendations that came out of the Kansas Alzheimer's disease task force. So you'll see those listed on page 8. Currently in Kansas, there are about 54,000 persons aged 65 or older living with Alzheimer's and other forms of dementia. And the number is estimated to increase to 62,000 by 2025. There was also a presentation on adult care home surveys and fines. And then at that meeting, the task force also discussed and heard a presentation on antipsychotic drug use, which was a topic that came up at several meetings. That was the Deputy Secretary of Hospitals and Facilities. Persons with a diagnosis of schizophrenia, Huntington's disease, or Tourette's syndrome receiving antipsychotics are not included in the totals of data, and that was a big discussion point for the task force, separating out those data for the people diagnosed with those conditions versus not. The managed care organizations, those are the contract organizations under CanCare in the state. They have incentive pay based on lowering the inappropriate use of those medications, and there was discussion in the task force about the trends in antipsychotic use in Kansas. At the November 10th meeting, the Deputy Secretary of Programs at KDADS provided information, including discussion of mapping services. This was, we'll actually come back to this in the recommendations, but this was a topic discussed several times in the task force, the mapping of the elderly population and services available in Kansas. There were several kinds of maps discussed, but specifically the task force thought it would be helpful to have maps showing the location of current senior population in Kansas with the mapping of services available in the state and then projections of the population going forward. And they noted the trend shows most elderly people who live in western Kansas, for example, are staying there. So sort of seeing where those services are now and where we can expect people to use those services in the future. There was also a presentation on distinctions amongst various categories, adult care homes, nursing facilities, assisted living facilities. There was also, across the meetings, a discussion of rebalancing of home and community-based services, HCBS. And rebalancing is just a term that's used that means providing alternatives to institutionalization. So balancing serving seniors in their homes and community settings versus larger institutions. And there are several aspects of rebalancing of HCBS, and you'll see now on page 13 that the Deputy Secretary of Programs at KDADS describes several incentives to help along that rebalancing of HCBS. So for example, the payment rate structure of the MCOs holds them accountable and incentivizes strengthening the HCBS system because it's more cost effective in the end for the MCOs to increase the number of individuals receiving services in their home or community settings. At that meeting, there was another discussion of antipsychotic medicine use. We heard from a family physician and a psychiatrist. The psychiatrist, I'll note, they noted the justification for the use of antipsychotics when the diagnosis is not schizophrenia, Huntington's, or Tourette's, so those accepted conditions should be supported by documentation from a psychiatrist. So there was a lot of discussion about medical diagnosis of those conditions, what that looks like when used in a community setting or in a home setting. There was also a presentation by DCF on abuse, neglect, and exploitation. And HB 2114, I'll note real fast, the same bill that established the Senior Care Task Force last year requires the Attorney General to appoint an elder and a dependent adult abuse multidisciplinary team coordinator to facilitate the convening of an elder and dependent abuse multidisciplinary team in each judicial district. So there was a discussion of how the task force addresses exploitation of seniors in the context of 2114 and how that multidisciplinary team will help that purpose. Moving to the last month of the task force meetings, the December 6th meeting, several presentations. There was an overview of community mental health centers, CMHCs, and how they fit into the larger structure of senior services in Kansas. It was discussed that CMHCs, while they provide lots of services, not just for seniors, but specifically for seniors, they provide caregiver support groups and therapy provided in nursing facilities. And they also partner with other agencies like Meals on Wheels and the area agencies on aging. There was a lengthy discussion about workforce shortages with a focus on services impacting the senior population on Kansas. The task force heard from KDADS, and KDADS meets weekly with nursing trade associations. They coordinate discussions with other agencies on state contracts for nursing staff. They meet with schools to determine barriers to training additional students, and KDADS works to identify clinical sites for training. So there was a lot of discussion about how each state agency serving seniors is laying out plans and is currently in work to attract more workers for the senior population in Kansas and retain those workers as well. On page 19, you'll see a brief discussion in that second paragraph from the bottom on the left about KDAD's and KDHE's joint FMAP enhancement spending plan, which includes some payments so a $2,000 bonus for each worker and a $200 training grant per worker, and then $1 million to investigate opportunities to create a career track for those workers with seniors. Finally, at the December 7th meeting, we heard several public comments from long-term care consumers, providers, and stakeholders themselves. So people who are living in these settings, who are receiving these services, what are their experiences with these services. On the good things side, they praised the care they received, the food they were served at some of these settings, and the compassion they felt from staff. On the concerns side, there's a list there on page 21, but just a couple that they mentioned, whether future funding will be enough to care for people going into long-term care who have memory issues, overnight issues disturbing their ability to sleep in these settings, not receiving medications, and so on, and those are listed right there. At that last meeting, we also heard a discussion on surveys of long-term care facilities, deficiency levels, and civil monetary penalties. And then I will just wrap up with the conclusions and recommendations. So these recommendations, since this is an ongoing task force, there were several recommendations discussed during the task force meetings that were put into a spreadsheet, and then the task force considered that spreadsheet. Some of those recommendations were then passed on to the work groups, which are still meeting, to have them consider those issues in more depth, and then think about whether they want to recommend to the task force in their final report whether to include those recommendations. But the task force did adopt, that's 5 recommendations at that last meeting. First, the KDADs should reach out to universities for assistance in mapping the various senior services across the state. So that's going back to the mapping we were discussing earlier. 2, the legislature should explore the possibility of using temporary aids in long-term care. 3rd, a request should be made to the Legislative Division of Post-Audit to perform a limited scope audit to determine where broadband funding, including federal funding, has been spent in the state, and to identify the differences between urban, rural, and frontier regions of the state. 4th, Kansas Legislative Research Department should research the funding for broadband for the state. And finally, the legislature should seek funding to produce a new Kansas Elder Count Book, including a digital version. The Kansas Elder Count Book was, I think 2002 was the last time there was a version of that, a very large compendium of data, metrics, trends on the senior population in Kansas, and that there's actually a digital copy of that on the KLRD website as well, and there's a paper copy up in the state library, I believe. So one of the recommendations is to provide an updated copy of that publication. That is my brief overview. Again, I'll stress brief. There's lots of stuff in this report, lots of topics I didn't mention that the task force heard. But if you have any questions about the report or the task force activities, I would be happy to stand for questions. Thank you, Madam Chair.
Thank you, Connor. That was a great overview. I feel like we got a lot done in those meetings. Committee, do we have any questions regarding the task force? Representative Hoy.
Thank you, Madam Chair. I'm looking at page 8 on the recommendations on Alzheimer's disease plan and introducing legislation to allow persons 60 years and younger, if they have early onset Alzheimer's, to access those services. And I'm wondering, I've heard recently that COVID can cause a fast onset of Alzheimer's or dementia. Was there any information on this? I don't know how new this is or how verified it is, but it does make me concerned that the anticipated increase in cases that you mentioned could be increased. We just don't know enough about the disease right now to know if that's a possibility. Was that discussed at all?
Madam Chair, Representative, I would have to look back at my notes to see if the effects of COVID were mentioned during that discussion. I'm trying to remember back to the discussions that we also had with the family physician and psychiatrist we had in another task force meeting, and about their discussion on antipsychotics. I don't remember specifically that issue coming up, but I can look back and see in the minutes and the notes to see if something came up.
Thank you. I think this is an important issue to look at. And so I guess my next question is a process question. If this is a recommendation to introduce legislation, does the committee task force work on that? Or is that kind of up to us to look at this plan and say, oh, that seems really important, I'd like to work on that, and we need to request drafts of those bills?
Madam Chair, so the recommendations from the Kansas Alzheimer's Disease Task Force that emerged from 2019, and those were recommendations that, as part of the task force's work, they considered during their activities, and certainly that's something the working groups can consider too. And when the task force heard the presentation on the recommendations, that fed into the larger task force discussion of what recommendations should we consider. I think there's the structure of the working groups facilitates that longer term discussion of we can consider these recommendations from other deliberative bodies, other legislative bodies, other commissions and task forces. And then when it comes time for the working groups to consider their own recommendations, they have that whole list of past recommendations that other bodies have recommended. And then they can sort of winnow down and create their own and produce their own recommendations, which the task force will then consider as their final report. So.
That makes sense?
I think so, and I can follow
There's
up
none.
and I just don't like requesting work that's already being done and in order to save time. So I'll do some more questions with other folks. Thank you.
We can visit some more. Any other questions? And I'll add that I am working on having the physician that testified to our to the task force. I believe he's going to be here for the KMS Advocacy Day, so I'm kind of hoping to get him in here next week to our committee, and we could talk to him about that early onset. I don't recall the discussion of COVID with that, but boy, it would make sense. Okay, any other questions? Representative Ousley.
Thank you, Madam Chair. And I do not recall any COVID conversation either. I do recall the physician and the psychiatrist were not supportive of medicinal marijuana. So when they are in this chamber or this committee room, I can tell you how they feel. But the Kansas Elder Count Book. In 2002, was that statutory or was that something that was done interdepartment? How do we go about getting that one up and going again?
Madam Chair, thank you. Representative, boy, I could pull it up to see who produced it on the first few pages. Madam Chair, I'm not sure if you remember who directed the production of the book. But if I take a look at the electronic version in 2002, I could probably get the answer here in about 5 minutes. But
Yeah. I don't recall. I think it was an agency as well, but I think Jesse's working on it here. I think I meant to look in the governor's budget to see if it might have been included, since that was one of our recommendations, and I forgot to do that. But we can always see if we can add that in through Social Service Budget Committee. Yeah, I can't imagine that it would need any legislative action, do you? Yeah. Okay. Jesse.
Yes, this is Jesse with the Revisor of Statutes Office. Thankfully, to the KLRD website, the elder count is on there on the committee page, and it says that it was produced by the Center on Aging, University of Kansas Medical Center, Kansas Department on Aging, Kansas Health Foundation, Kansas Task Force on Long-Term Care Services, and the Millbank Memorial Fund.
All right, thank you. I don't know why you didn't have that memorized, Connor. Okay, any other questions? All right, thanks, Connor. Okay, next up we have Leslie Anderson with the Area Agency on Aging, and she's with us virtually.
Thank you very much, Madam Chair and members of the committee. I'm Leslie Anderson, and I am the director of the association that represents the 11 area agencies on aging that serve your constituents throughout Kansas. Thank you for this opportunity. Area agencies on aging cover all 105 Kansas counties. 3 of the 11 are administered by county government, and the remaining 8 are nonprofit organizations. Each AAA has their own governance board and advisory council. I'll give you a little bit of the history about the AAAs and how they were created. The Older Americans Act was signed into law in 1965 when the Medicare premium was $3 a month. The original act was the catalyst for every state and community to move toward a coordinated program. When the act was reauthorized in 1973, the AAAs were established to provide a set of core services, which I provided on the first page of my testimony, to help older adults stay as independent as possible in their homes and communities. An emphasis remains on older adults with the greatest social or economic need. In response to the growing demand in short-term Medicare services, AAAs offer other options under the Older Americans Act and Senior Care Act to help older adults avoid hospitalization and nursing home care, saving federal and state funds. To receive a AAA service, an assessment of needs, cognition, and risk is required to determine eligibility. The OAA approach is based on service provision rather than on income. AAAs enter into contracts with community providers to ensure unbiased, community-based options are available to their customers. AAAs are experts on aging issues at the local level and are quite diverse based on community need, which is why no AAA is the same. Service standardization is not required, which allows a AAA the flexibility to design and implement services specific to their planning service area. I want to pause here for a bit and recognize the work of the silver-haired legislature on behalf of the Senior Care Act and Kansas legislators for appropriating an additional $3 million to the program's base funding. Thank you. The Senior Care Act was enacted to offer an option for older adults with functional limitations in self-care and independent living to avoid premature nursing home stays. This program does not replace other federal and state funded programs such as the VA, CanCare, or Older Americans Act. The AAAs are commissioned to administer the statewide program that addresses social determinants of health and provide related services. Most older adults want to contribute to the cost of their care, so the sliding fee scale helps determine cost sharing of the program to help it remain cost effective. Partnerships are vital to connecting older adults with resources. Growing demand means establishing and strengthening partnerships and working together to make things happen. As an example, when the pandemic was in full swing, AAA's partnered with ks and Sunflower to distribute PPE and tablets to help keep direct service workers safe and customers safe as well as connected. On a systems level, AAAs help strengthen the infrastructure by networking and providing expertise on councils, commissions, task forces, and stakeholder groups. They offer a perspective that is usually overlooked. I mentioned earlier that AAAs evolve, and the contracts for the Level 1 nursing home assessments, the Aging and Disability Resource Center, and administrative case management are all examples of enhancing the no wrong door system or single point of entry. Our recommendations are based on what we are seeing at the local and statewide level. Aging is quite different now from 1965, and we want to ensure aging in place is supported by adequate funding levels and appropriate programs and services. Thank you for your time and your commitment to serving older adults, and I will stand for questions.
Thank you, Leslie. I've got a couple of questions. Do you have a waiting list for services?
So it depends. It depends on the area and those services that are being requested.
So there
could be, you know, as I mentioned in my testimony, each AAA is different based upon the community need and the services that they are providing based on that community need. Sometimes what happens is if an individual is needing services but are unwilling to pay the copay, they might stay on that wait list. Or if there are additional services that are needed and they haven't been made eligible for those services, you know, they could be on a wait list.
So
but we try not to.
What'd you say? Okay, in general, how would you describe those the waiting lists? Are they minimal, or are there areas that have a long waiting list?
Why don't I reach out to the AAAs and get you that information? I know KDADS also gathers that on a statewide level, so they would have that in their reporting.
Okay, great.
Write that down.
And then how is your funding nowadays? Do you feel like you're fully funded?
You know, OAA is a federal pass-through. Okay, so the state doesn't have control over that, and that is based upon the census. So we just had a census. So the state could not be in control of any of that, of course. The Senior Care Act, thankfully, we were able to get an additional $3 million. As you're probably aware, the funding fluctuated so much, and in 2017, about 38% was cut, and that really impacted the services. So this $3 million brought it up to where it needed to be to address those needed services in the community.
Yeah, I remember those cuts very well, and I'm certainly glad to hear that that's been restored. Anyone else have questions? Well, we're a quiet group today, so Thank you, Leslie, for joining us today.
Thank you for the invitation. And if at any time you need more information from us, give me a call. And, and that Graham is also on the task force in which you're the chair. So she's available for information as well. So thank you.
Yeah, I think we're going to hear from her next week.
Yes, you are.
Yep. Yep. Okay, thank you.
Thank you.
Okay, I'm going to do one more thing before we wrap up. Mitzi, could I call on you to, okay, I'd like to introduce Mitzi McFadridge. Could you come up and so this is relatively new committee since you were here last, and so I wanted committee members to know who you are, and if you would tell them who you are and who you represent.
It's an honor to be here, and thank you for the opportunity to introduce Kansas Advocates for Better Care, where I'm currently the interim director. I served as the director at KABC for the last 13 years and then was gone for a year, and now I'm back as interim. KABC advocates for older adults and long-term care. We have about 650 members across the state. We're interested in the quality of long-term care that older adults get in nursing homes, in assisted living facilities, and through home and community-based services. We've been around since 1975. We have a tremendous amount of expertise on all things that have to do with aging and long-term care in the state from consumer perspectives. So anytime that myself or Barbara Conant that works with us on legislative issues can be a resource to you, we want to. And anytime we can be a resource to your constituents, we're happy to do that as well. We offer support and guidance for older adults and families as they try to navigate long-term care needs. We have all kinds of free resources on our website, educational materials. We certainly have those in print and can share them with your constituents as well. There's never any cost for the services that we provide to individual Kansans. So we also do trainings around the state on elder abuse and on long-term care quality issues. So anytime we can be a resource to you or your constituents, we welcome the opportunity to do that in order to make long-term care for better for older adults in our state, which I know is also a concern for each of you.
Thank you. I knew you would be ready to speak even if I caught you off guard. So thanks and welcome back.
Thank you.
It's good to see you again. Anybody have questions for Mitzi? Okay, great, thanks. Okay, that's it for our agenda. We are not meeting tomorrow, so we'll see you back on Monday. We're adjourned.